Hello, welcome to Live with Dr. Jodi. And we're going to be talking about dual brain psychology today. I have a special guest here, Dr. Schiffer. His name's Fred, and he is a psychiatrist. He's an assistant professor at Harvard Medical School. He's a researcher, inventor, and an author of a book coming out this fall. It's called Goodbye Anxiety, Depression, Addiction and PTSD, the life-changing science of dual brain psychology.
Mhm.
I've been reading about this dual brain psychology since I booked Dr. Schiffer on the show. And today he'll share with us how the brain works, what happens when we experience trauma, and all about this dual brain psychology. And how it could help with depression, with anxiety, with PTSD, and with addiction. So let's get started. Welcome, Fred. It's so nice to meet you today.
Hi, nice to meet you. Uh, so, why don't I start off with a brief explanation of what dual brain psychology is? So,
I'd love that.
Dual brain psychology is the first psychological theory to come out of rigorous experimentation, specifically the dual brain studies of the 1960s, and to be tested rigorously at Harvard, at McLean Hospital, with high-tech modalities and also clinical trials. And so it's a theory that has, to my knowledge, it's the only theory that has been sort of scientifically tested. And the premise of dual brain psychology is that trauma, very broadly defined as whatever hurts us, especially in early childhood, gets associated with one brain hemisphere or the other, either the left brain or the right brain. And that we commonly think that the right brain is a negative, and in many ways it is. But in what I'm doing, it seems that we have two minds. We have a mind that comes out of the left brain and out of the right brain, and the one of these minds is more affected by past traumas, and so it's more troubled and has more symptoms and more behaviors that are troubled.
Can I ask a question? How do you explain, or how do you understand after doing all this work, which side it is? Because you said when we experience trauma or something that hurts us, it could either be lodged. I don't know what you said, lodged
Right.
or
Yeah.
in one side or the other. How does it pick which one to do, or how do you understand how that
Well,
happens?
the answer is that I don't understand it.
Okay, me neither.
And it might have something to do with the type of trauma and the timing of trauma in development. It seems to me that the healthier side seems to develop more in late adolescence, early adulthood, and that younger children don't seem to have it as much.
When you say the healthier side, it could be a different side for each person.
It is, yeah.
Yeah, okay.
But for a given person, it's the same side.
Okay, and so it's the one that the trauma hasn't lodged in, or some trauma.
That's right.
Like, what if you have more than one experience? Is it always just put in the same side?
Yeah. What I can show you is how we. This is my equipment. So I'll ask a patient to get their equipment, and if you block here, I'm blocking my right eye, and now the middle of my left eye, and it's important that I'm not looking out the whole left eye, but half the left eye. So I'm looking out my left lateral visual field, and with fMRI studies, which show the blood flow in the brain hemisphere, we have found that when we do this, it actually activates the opposite brain. It has to do with the way the eyes are connected to the brain.
Hmm.
And if I go like this, I activate my left brain.
Okay.
And so the first time that I tried this, and I won't go into how I came to do this, but I was using my hands, just going like this, and I didn't respond. And I asked a patient who was a Vietnam veteran to try it, and he had had 4 tours of duty and a Purple Heart, and had severe PTSD, which he was doing quite well. But he looked out his right lateral visual field, which would stimulate his left brain. And he got very upset. And he said, that plant behind you looks like the jungle. And so I saw that he's having a flashback. So I immediately said, well, look out the other side. And he did, and he smiled, and he said, oh, that's a nice looking plant. And I see this every day. And about 55% of my patients have these really intense responses.
So, like, I could try it right now?
Yeah.
Yeah, I don't have, I mean, I've done so much work on myself, and I don't feel like I have too much, so nothing's gonna
Yeah.
come up, but I really want to try this. So if I look out halfway through
Yeah, that's perfect. Good.
and then look into the world and
Yeah,
see
and
how
let
it
me
feels.
sort of intensify it a little bit. So let me
Okay.
ask you to think of something upsetting. Uh, Maybe a childhood trauma or whatever. The response is very quick. So I could
Okay.
ask you to measure your distress from 0 to 10. It's good.
I
It's good.
didn't have much, I guess, so it was low. So let me try the
Okay.
other
Yeah.
side.
Try
So I
the
would
other.
say like 2 maybe,
Okay.
because I was trying to think of something terrible.
Okay.
Okay, so same.
Same thing.
Maybe a little bit higher, but maybe it's
It,
maybe my trauma's healed.
yeah.
I
Yeah.
tried to think of the most awful thing I could think of.
Okay, well that's good, and it's good that you didn't respond. And I've never seen a neurologist respond, whatever that means. Uh,
Huh.
so it could be that your two hemispheres are getting along well, uh, and but it'd be interesting to try it in your practice and see if you find a difference. And then what I can do is I can talk to 2 people. So in someone who's having a response like this Vietnam vet, I'll look critical on one side, and I don't look just kind of randomly critical, but I look critical like his mother was, and he doesn't like himself, and if he has drug cravings, they increase. And out the
Okay.
other side, I look like an empathic therapist. And
So you appear to him, you mean?
yeah,
I thought at first when you're saying at one side I look critical, like I thought you were looking critically at that side, but you mean you to him,
yeah,
you appear like his critical, like his mother, like the
yeah.
energy of his
It's like
mother, and on the other side, you're an empathic therapist
yeah,
or
yeah,
psychiatrist.
yeah, right. So it's not
That's
just
interesting.
like a pain or craving. It's really a whole view. That's why I call it of 2 minds. That
Yeah, yeah.
a brain.
The whole like rose-colored glasses or trauma-colored
Yeah,
glasses.
yeah. It's a different person, and they both have the same address and the same social security number, even the same birthday. Uh, but I can. They're very different when I talk to them. And sometimes one of the problems that I encounter is that the troubled side doesn't want to give up power. And he's been in power and running things for 30 years and using drugs or alcohol or whatnot. And, he sort of is saying, you want me to retire and go on disability? To hell with you, so a lot of the therapy is kind of a negotiating and a working with the troubled side to try to show it that cooperating with the other side could be helpful. The other side could help you, and the healthy side becomes a co-therapist in dual brain psychotherapy.
I see. Yeah. Okay. So you're trying to converse with the happier side or the preferred side or the feeling good side. And how do you use that side to try to heal the other
Well,
side?
a couple of things. One is that it's very clarifying when if for instance, if I the feelings he has about me lead to the trauma, then that becomes very clear, and that's why he's suffering. And so the technique is very clarifying in terms of what's going on psychologically, and I work with both sides. So I try and encourage the adult side to be more present, and um, I have a patient who's a physician, and I say, calling Doctor so and so, and I try and rouse her up, and she'll do well if there's a crisis or a need, and her strong side comes out. But she also has a very depressed, troubled side, and and I try and get her healthy side to be like a good parent and to talk with her and help her and sort of to be a co-therapist. So the real aim of the therapy is the treatment of the troubled side
I see. Yeah.
and the trauma that it had. And
But you find that, using, aligning and with that good side or that I'm trying not to use like
yeah,
good, bad, but, because I
but
don't know if
it is a healthy and a neurotic side.
yeah,
Yeah.
right. So it's like a preferred side and a troubled side,
Hmm.
but because I want words that are changeable,
Yeah.
because that troubled side could get untroubled.
Yeah. And that's the aim of the therapy, is to make it untroubled. It's going to remain a child, but I think of it as like a corporation. So it needs to get out of the corner office and go into marketing or research,
Yeah.
do something that it's more capable of and
Okay.
cooperate with the other side.
So you wrote this book, Goodbye Anxiety, Depression, Addiction, and
Hmm.
PTSD. And I thought this is really interesting because it's very based in this, the therapy, the work in the therapy session of how to use it. And it doesn't sound like it's a prescription. You do this, the protocol.
Right.
It's just a listed out stuff. So that's really hard to write a book when it's something that you've been in the moment, case by case, trying
Right.
to understand something and work something out. How did you put that in a book? And it's a self-help book, right? It's not for therapists.
Well, it's
It's for
no, it's
people.
for therapists. It's hard to connect with therapists, so that therapists often, uh, have their own way of doing things, and so I find that it's hard sometimes to bring in a new idea, especially one that is coming from left field, and. Uh, but it's for therapists, and it's for ordinary people, and it's
Okay.
for intelligent readers who want to know more about how the mind works. So in the book there are narrative, fictional depictions that are accurate depictions of a therapy session, and so there are about 5 of those in the book, and they give a good feeling for how I work with the patient.
And have you done trainings? Like, do you train other therapists? And is there a
Well,
bunch of people
I'm
doing it?
trying
Like, what
to.
if somebody what if they watch this interview and they're like, I need this?
Right.
This just,
Uh,
where would they go?
uh, well, it's hard to get an audience for it, and so maybe after my book comes out, there'll be more of a demand for training. So I'd like to train people because I think it's very empowering. I think my patients get better more quickly than they used to, and I think the improvement is more solid. And
Yeah, it lasts a long time.
yeah.
Yeah. How long have you been using it in your practice? How long have you been using dual brain psychology? Or when did you
Um,
call it that? Like, you're the person who named it, right?
right. So that day in my office was really the birth of dual brain psychology with the Vietnam vet.
Yeah.
And that was in 1995.
Okay.
Mhm.
And you have a private practice still up in Massachusetts,
Right,
and I know you do a lot of different things, but that is
right.
one
We're
of your
running
jobs.
a NIH study to treat fentanyl addiction.
Okay.
And we're using a special LED that we developed at Mass General, and we put it over the positive hemisphere to simulate it. And we're
Yeah, that's a
getting,
light. I was reading about that as well. If
yeah,
people don't know, LED is he's talking about the light bulb, LED, right?
uh, but it's a special LED.
Special light.
It's a super luminous LED that we had
Oh.
manufactured, and uh,
And so you point it towards someone's
yeah, you
forehead.
put it either over here or over here, depending on which is the the more mature
Right.
side.
Okay, 'cause you're using the dual brain psychology and knowing which side is the mature
That's right.
side or the healthier side, and then you put the light on which side? Say that again, I'm
On
sorry.
the positive side, the light.
Okay, the
So
healthy side.
the visual technique crosses over. The light goes through the skull and
The same
into the
side.
brain, and has no side effects that we've encountered. It could, in the future, but we haven't seen any side effects, and the FDA has determined that it has no significant risk. But
Okay.
what it does do, that the light does stimulate the healthier mind, and the person feels better. And if I give one study that I'm just submitting,
Yes,
I
please, I was gonna ask, good.
I'm sorry.
Yeah, I said, "Yes, please." I was gonna ask, like, could you give us some stats? Like, what have you noticed?
Um, well, in the study that I just submitted, I did a Beck depression scale, which is a good measure of depression. It's easy to administer before and after, immediately after a treatment, and and there were marked improvements. One person had a depression score of 34, which is very high, and after treatment went down to 4. Now he's an outlier, uh, but most people, they'll ask for a light treatment. Can I get a light treatment today? And and
We
we're
like treatments when we don't have to do any work, right? It just is like, can we have some of those easy things that we
uh,
just sit and we get better without having to do any hard work? We like
um,
that.
well,
I'm not saying that I'm
it's
saying that, like,
interesting.
happily.
Yeah, that in the we're treating fentanyl addiction. Now, fentanyl is very hard to treat. It's hard to get to people, and the group many of the half the people are getting a sham device, which is a placebo, but half the group are doing extremely well and have stopped their fentanyl or decreased it 70-80%, and a couple of people who finished the study, it's a 6-month study, said they want to dye their hair and come back as another candidate. Uh,
Yeah, I was wondering, like, sometimes the ethics of research when people are getting so much better
yeah,
and the people who are the control group are not or at risk, that does bring into
yeah,
some ethical questions,
it's an
doesn't it?
ethical problem,
Dilemma. Yeah.
and it's painful,
Yeah.
but it's the way the
You have to
FDA
prove if
works. Yeah,
I know you would just wanna give it to everybody if it's helping.
you do. Yeah, and
Yeah.
and hopefully one day I'll be able to.
Yeah. Yeah, wonderful, because I think the overdose problem is growing everywhere,
Hmm.
and there is not enough response to that. I think there's a lot of agencies that, I've been talking to some people locally about um how hard it is to do that work, like how to get support for that, to harm reduction, or
Right,
um how to help people who are hard to, they don't come in, right? They're not going to
right.
come into the hospital center, and we need more mobile clinics and to reach them. And so I really appreciate this, and I'm going to share it with my colleagues because
And
it's
I
very
also integrate it with the psychotherapy. And also, I have uh, what I call Dr. Schiffer's stress reduction sunglasses. And they are like the envelope, only you can see through it. And they're effective. And I think all my patients use them.
okay. So you're saying you have like sunglasses that take like 3/4 of your vision out,
Yeah,
leaving just partial the healthy side.
yeah,
So my right would be my left if my left was my healthy side. Um, and so they spend some parts of their day with these on
that's right.
to
Yeah,
be more and more connected to that healthy side?
yeah, that's right.
Interesting.
Yeah.
Yeah,
And
that's
also, I have them
great.
use the negative side so we can talk to the troubled side.
Okay.
And so you can have it there in a sort of stable way and have
Okay.
a longer conversation.
Like in controlled situations where you're
Yeah,
like,
in
"That's
a
let's do
therapy
this
setting.
practice now, let's do this healing now."
Yeah.
Okay. It's very exciting. It's
Hmm.
very exciting stuff.
Yeah.
Yeah.
And the real
So
treatment for the trauma is it's the same old thing. It's that you have to grieve it and bear it and process it and not be so terrified of it
mhm.
uh, and uh, sorry. Um, uh, uh, so that's the real treatment is to treat the trauma, and when
Yeah.
we do that, we get the best results.
That's great. Okay. So yeah, so then you go to talk therapy, but the talk therapy itself is so much more effective
Hmm.
because you're really you're getting you're being able to use that healthy part of the brain, or this I keep wanting to call it dual brain technology instead of dual brain psychology,
Uh-huh.
but
Uh-huh.
it's a similar concept, but very exciting. And then the light, using the light,
Hmm.
that is really, really exciting stuff. And I was picturing, you said they come in for the group, or I think you were talking about the control group and then the group that was getting the research group. uh, I was thinking that if you brought people in for a group and they did the light first and then were able to talk to each other or do a group therapy session, how much more impactful would that therapy section? That's where my mind went when you were
Yeah.
talking about it. How much more impactful would they, if they were like in the waiting room and they did the light and then they came in, would their openness or responsiveness to the conversation be different after having that
It
light in
can
that?
be. Again, there's a lot of variation. And it's a therapy session, so it's sort of like a soccer game, where you run wherever the ball is, sort of. Uh, but in that patient who went from 34 to 4, sometimes he'll come in and he's just depressed and he has nothing to talk about and everything in the world is bad. And I'll say, you look like a man who needs a light treatment. And uh, and so I'll give it to him, and then his demeanor changes, and we can work on his problems which we couldn't before. He
Yeah.
had suffered horrible trauma, and 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 that's sort of the problem when the trauma is really severe,
Mhm.
that the that immature part tends to hold on and use a repetition compulsion and it thinks like a child.
Yeah. Of course, yeah, these affect us so huge. You don't have a copy of your book to hold up. I saw you have
Yeah,
a
I do
photo of
actually.
yourself with
Yeah,
it.
yeah. Thank you.
It just we'll put it down below, a link to it, but of course, if you wanna hold up the book.
Uh,
Oh, the other side.
yeah, the other side. There we go.
Oh, that's great. Goodbye. I love that. My book's called Anxiety, I'm So Done With You, so they're really similar,
Uh-huh.
like goodbye anxiety, good riddance, you know? I like that book title, like Goodbye Anxiety, because it's personified those problems as well, which kinda disconnects it with our identity. So we
Yeah,
have
and I
we're
also feel that all these diagnoses are destructive. To
yeah,
call somebody borderline or bipolar or addict, that they're all demeaning and they become a new trauma.
they
Uh,
absolutely. Like, they take on those identity conclusions. Yep. Two
yeah,
peas in a pod here.
it's all due to early trauma that kind of snowballs, and that really is not demeaning.
Yeah. Yeah, I think so too. I like to say, that's a reaction to trauma because I really, my biggest message is reminding to let people know that what they feel is a regular human response
Right.
to our world
Exactly.
or experience. It's not a mental illness and it's not an inherent problem or
Right. And
the way your brain's wired, it is a response. It's a regular
exactly.
human response to the world and your experiences and whatever. And I think that's really helpful for people.
And I
Really,
think the
really helpful.
problem is that if you know what you're afraid of, if your neighbor is threatening you, that we call fear. But when somebody comes in with a panic attack, or they come in, they say I've got an anxiety disorder. Uh, they don't understand what they're afraid of, and what we do is we trace it back through their feelings to arrive at the trauma, and where the anxiety is, what the anxiety is really about is the old trauma that the little boy or the little girl inside can't uh, trust that he's not going to be back in Vietnam,
Yeah.
or he's
Yeah.
not still in Vietnam.
Yeah. Yeah, that's beautiful work that you do. I'm so glad to have this interview. We could go on and maybe I'd have you on again. I was kind of think we didn't know each other before we did this, so this is nice. This might be the start of a professional connection for us.
Yeah.
And I'd love to have you on again. And I'm thinking it'd be great to have somebody with us that you could, be practicing so we could see it live with permissions, obviously. But so it's very exciting to hear about this. I love new things that could help me help people because that's what I do all the time. You know, um, to really help people know that they are more than they think they are. In
Mm-hmm.
this moment, and we could help them realize that or bring that out or self-actualize. And so there's so much hope for healing as even if you've had horrible trauma. And so I think this
Absolutely.
interview proves it. And there's good people out there. If people want to get in touch with Dr. Schiffer, his website is dualbrainpsychology.com. I'm going to put it below, dualbrainpsychology.com. You can find him on LinkedIn at his name. I'll put that down below too. And you're not in any other socials, Doc?
Um, I am,
Not
but I
yet.
don't know exactly how to find myself.
You gotta once the book goes out, you probably have to figure that all out. But
Uh-huh.
yeah. So, well, thank you so much. Any last words for our audience?
Um, well, it's a pleasure meeting you, and for the audience, I think that you need to consider that there might be a reason why you're upset, rather than you've got some undiscovered genetic problem, and that if you can follow your feelings and get in touch with that and get some help to help uncover it and work on it.
Beautiful. Thank you so much. Thank you. And thank you all for watching Live with Dr. Jodi. If you're watching the recording or if you're listening to the podcast, just know that I go live every Monday at 8 p.m. Eastern on my YouTube channel. That's at Dr. Jodi, at DoctorJodi. And you could get reminders for the show, especially knowing the topic or the guest that's coming on. Go to jodiaman.com/guide. And for signing up for reminders, you'll get my Generation Z mental health resource guide. That's for teachers and parents and counselors to help them help this generation get better, feel better, do better, and see all the good that they are inside. So I'll see you next week. But until then, remember, you are so much more than you think you are.